Let's talk to Paul Morland now. He's UK's leading demographer and author, because we've got some new figures, which I just told you about. 72.5 million is the expected and projected population figure for this country by mid-2032. That's up from 67.6 million in mid-2022, so that's 10 years on. It will have risen by, not far off 5 million. I wonder if that numbers are being a bit underestimated, but let's find out from Paul what he makes of it. Paul, very good morning to you.
Good morning.
It seems that the net migration is the driver for this increase. They're suggesting that 340,000 per year is going to be the net migration figure. That's quite low compared to what we've been getting recently, isn't it?
Well, there are two things going on, obviously. There's the balance of births and deaths, and then there's net migration. So on the balance of births and deaths, they are now almost entirely matching each other. And that's because we've got the boomers, the boomer generation, starting to die. A lot of people born at an age now that there's quite more deaths than you might have expected, and a big drop-off in births. That's the big surprise that happened in 2024. We thought it was some years before births were going to be outstripped by deaths. It's come earlier. And it's come earlier essentially because people are having far fewer children than we expected. Now, that balance is really, really small. The fact that it exists at all is significant because we'd expect births to outstrip deaths normally. So the fact that it's come early and it's going to accumulate and accelerate is important. Again, but it's still very small. So the population would be aging, but roughly flat. The real delta, the real thing that makes a difference is immigration. Now, the ONS has no more idea than you or I what the real level of immigration is today. And we know it's a hell of a lot more than 300,000. And more importantly, if you're projecting forward where it's going to go. Now, if we had an election tomorrow and we had a different sort of government and a different sort of policy, the government wanted to bring it down and were prepared to, and were prepared to take the legislative and constitutional possibly steps to do so, that can happen. So this is not a given. They are taking a best guess, and that's the best they can do based on what they think the political pressures might be. But it could stay at 1 million a year. It could become negative. That is down to the government, and in a democracy, it's down to the electorate.
Yes. I mean, the one thing I suppose we do know that's happening, and there was some sign of it coming towards the start, I think, of this year, was when Rishi Sunak banned the additional sort of relatives of those people coming here to study and said that they couldn't come with them. That number appeared to drop, didn't it? The numbers of people coming on student visas seemed to go down because they couldn't bring their families with them. So, I mean, I suppose if you're looking for any positives, if you like, in the reduction of immigration, that might be one.
Well, there are various quick wins. I mean, had Rwanda gone ahead, for example, although not many people would have left, I suspect, that probably would have acted as a major disincentive for people coming over on the boats.
Right.
You're absolutely right about dependence of students. Similarly, if a government came in and decided we don't need a hugely bloated university sector full of people from overseas, very often not studying very serious degrees and getting in and not going, that would also have, if that's what the government wanted to do, that would also have a big effect. If we decided to change the level of earnings of which people could come into the country, for example, if we said we only want workers, or if we introduced a sort of Gastarbeiter type scheme where people came in for 5 years to help out and then went home, there are all sorts of things we could do. The idea that we cannot control our population and that we cannot control the immigration level is completely untrue. It requires will, it requires decisiveness, and it requires the people of the country or the government to have a view on what it wants.
Yes.
But neither the ONS nor you nor I are going to determine it.
I mean, the interesting thing for me is that the figure from 2022, which is 67.6 million, if you look at what we know from, say, the last 2 or 3 years, even bringing it up to date, our net migration figure has been somewhere around 770,000, isn't it? So, I mean, you could add into that, say, another 2,000 or so. I mean, you're not far off 70 million right now, I would say. And even with kind of taking a broad brush approach to how many people we don't know are here, I think 70 million is about where we are now.
That's probably not an unreasonable guess. I mean, we really don't know. And the fact we don't know itself tells us something about the political priorities. But I do think there's a lot of discussion of immigration, and that is the really important issue in terms of numbers year to year and decade to decade. But I think there's another huge issue here that we're not discussing nearly enough, and that's the great drop-off in the number of people having children.
Yes.
The fertility rate per couple is now below 1.5. It's the lowest it's ever been in our history. That's a huge can of worms. There's a big discussion about why that is the case. But it is building up a huge problem for us in the future. We're going to have a rapidly aging population. It's going to create a demand for ever more immigration. And unless we do something about it now, there's no light at the end of the tunnel. And what that means is we're going to have fewer workers, more retirees, more spent on pensions, more spent on social care and healthcare. It's very hard to have any kind of decline in taxation or any kind of competent government balanced budget when you've got that kind of demography. The demography we've got because of having too few children, number one, is itself sucking in huge numbers of immigrants because we're short of workers. And number two is ensuring we have a stagnant economy for decades ahead.
Well, that's true. And it's also happening in America as well, because I saw Vance, the vice president, there talking about it the other day, saying we need more babies in America. And it's a Western malaise, isn't it? Because a lot of younger women now are choosing not to have kids at all, not just choosing to have them later in life, but just not choosing to have any.
Well, a couple of things I would say. First of all, it's not just a Western malaise. China, Japan, Jamaica has a similar fertility rate to us. This is a global phenomenon. The second thing I would say is hats off to J.D. Vance. In Britain, we've had too few children, so below replacement rate, for 50 years, more than 50 years now. And no front-ranking government minister has ever had anything to say on it until Keir Starmer finally spoke on the matter. And what did he say? Not my business. I'm not going to force people to have children. Well, of course, he's not going to force people to have children. But we've never had a front-ranking government minister who has said, this is a problem, this is an issue, let's start to talk about it as a society. And unfortunately, it's only people on the fringes of politics and people like me who are talking about it. It's still seen as a weird thing to talk about in this country. We've got to change that if we're going to fix it.
Yeah, well, listen, you can always talk about it on here whenever you like, Paul, because I'm very much in agreement with you. And also, you know, we need to talk about things here at Talk that other people don't, because I'm sick of people demonstrating how we should be talking about things, what we should be talking about, and when we should be talking about them. So feel free to come on. I've had 4 kids, so I've done my bit. Thank you very much indeed. Paul Morland from the UK's leading demographer and author, with the news that the UK population projected to reach 72.5 million by mid-2032.